Did you know that more than 80% of people who use baking soda have no idea about its most powerful health secrets? This common kitchen staple, costing just a few cents per dose, is hiding in plain sight in millions of homes, quietly holding life-changing health benefits. And yet, most people only use it to bake cookies or deodorize the fridge. What they're missing could change the way we think about aging, chronic discomfort, and everyday health. In this two-part series, we're going to uncover the truth about baking soda. Not myths, not internet fads, but deeply practical, science-supported uses that have been hiding in plain sight. These are not vague promises or miracle claims. They're grounded, accessible, and potentially transformative. If you haven't already, subscribe now and hit the bell so you won't miss the second part of this series. And if this content speaks to you, hit the like button so we know to make more. Now, let's dive into the first 5 benefits. Relieve heartburn and acid reflux. Heartburn isn't just annoying. It can rob you of sleep, make meals miserable, and chip away at your quality of life. For many seniors, it's become so common, it's almost expected. You feel the burn creep up behind your chest, sometimes reaching the throat. It's not just discomfort, it's disruption. But what if relief didn't require pills? What if it came from a teaspoon? When you mix baking soda with water, it forms an alkaline solution that neutralizes stomach acid fast. The reaction is chemical, not wishful thinking. Sodium bicarbonate plus hydrochloric acid equals salt, water, and carbon dioxide. The gas escapes as a burp. The acid gets neutralized. This simple fix has been used for generations. And unlike antacids that can interfere with digestion or have long-term side effects, a small amount of baking soda gives your body the help it needs, on your terms. That said, it's not an everyday solution. Baking soda contains sodium. If you have high blood pressure, kidney issues, or are on a salt-restricted diet, ask your doctor before using it. But for occasional relief, especially after a big meal or lying down too soon, it can be a lifesaver. It's not just the science that matters, it's what it represents. A moment of comfort, of self-agency, of reclaiming ease in your body without a prescription pad. Support kidney function. The kidneys work silently, but relentlessly. Every minute they filter about half a cup of blood, removing waste, balancing minerals, and regulating pH. But with age, diabetes, or hypertension, their efficiency can decline. One of the lesser-known consequences is a condition called metabolic acidosis. As kidney function weakens, acid begins to build up in the body, and that acid, it accelerates further kidney damage. This is where baking soda earns a surprising place in functional medicine. Research has shown that medically guided supplementation with sodium bicarbonate can buffer that excess acid. In fact, in one long-term study, patients with chronic kidney disease who took baking soda declined more slowly and were less likely to need dialysis. Think about that. Something sitting in your pantry may be capable of protecting one of your most essential organs. Of course, you must approach this with medical oversight. This isn't a hack. It's a biochemical strategy backed by evidence, best used by those whose doctors understand how to dose it precisely. Still, the potential here is profound. For seniors managing multiple medications and chronic conditions, the idea that one natural compound might slow kidney decline is a breakthrough worth exploring. Ease urinary tract. Discomfort. UTIs can be relentless. The burning, the urgency, the exhaustion, especially for older women, can feel like a cycle that never ends. Antibiotics treat infection, but what about support in between? Baking soda may offer a gentle, non-pharmaceutical option. By slightly raising the pH of urine, it makes the environment less acidic, and therefore less welcoming for bacteria like E. coli, which thrives in acidic conditions. It won't cure a full-blown infection, but it may help calm the tissue and reduce irritation. Anecdotal reports and early studies show that women who used a diluted baking soda drink experienced fewer flare-ups and reduced discomfort. It's not a miracle, but it is a step. And when you're managing pain and frustration, even small wins matter. Half a teaspoon in a glass of water. That's all it takes. Still, always talk to your doctor before using it regularly, especially if you have any underlying health issues. Also worth noting, recurring UTIs can lead to systemic inflammation, affecting your sleep, mood, and even cognition. That's why finding gentle, supportive ways to soothe irritation between infections is more than comfort. It's about preserving quality of life. Help with gout flares. If you've ever had gout, you know it's not just pain. It's immobilizing. A joint so swollen and sensitive you can't bear the pressure of a bedsheet. Gout is caused by a buildup of uric acid in the blood. When the body becomes too acidic, uric acid crystals form and settle into joints, igniting inflammation and agony. Baking soda, as an alkaline compound, may help the body excrete more uric acid by creating a more favorable pH environment. When used under medical supervision, it could reduce the frequency or intensity of flares. It's not a replacement for diet changes or medications, but it can be part of a broader approach, a natural buffer that softens the blow and gives you back a measure of control. For seniors who already feel like their bodies have betrayed them with arthritis, stiffness, or metabolic dysfunction, this is about more than relief. It's about restoring trust in the small things that support resilience. Soothe mouth sores and bad breath. Here's one you might not expect. Baking soda can support your oral health in ways your minty mouthwash can't. Whether it's a canker sore, gum irritation, or dry mouth from medications, a gentle rinse made with baking soda can bring fast, sting-free relief. Why? Because it neutralizes acid and balances the pH of your mouth, making it harder for harmful bacteria to thrive. And that same alkalinity that helps inside your stomach, it calms inflamed tissue and helps sores heal faster. Unlike harsh commercial rinses, a baking soda rinse doesn't burn. It doesn't mask the problem. It addresses the cause. And yes, it even freshens breath. Not by covering up odor, but by changing the chemistry of your mouth so odor-producing bacteria can't survive. This is especially useful for seniors dealing with xerostomia, chronic dry mouth, a condition that not only impacts digestion, but increases tooth decay. A baking soda rinse can be a gentle, consistent defense. So there you have it. 5 science-backed, accessible ways this humble white powder can support your health as you age. Not as hype, not as folklore, but as chemistry, as care, as possibility. In part 2, we'll explore how baking soda can support muscle recovery, balance your body's internal pH, and even help soothe irritated skin. If you haven't already, hit subscribe, turn on notifications, and stick with us for what might be the most surprising insights yet. Because sometimes the best medicine isn't new. It's just finally being seen. Thanks for watching and tune back in for part 2.